Hello everyone, and welcome to my talk examining social vulnerability in children with WSS. So let's have a bit of background to start with. So for my undergraduate project at the University of Sussex, I conducted a survey looking at sociability characteristics in children with WSS, and I compared these to autistic children and children without a disability. I wanted to compare these three groups to see what social vulnerability looked like in WSS. So just before we start, what is social vulnerability? So for this study, we refer to social vulnerability as an impaired ability to detect and avoid harmful situations and interactions. Social vulnerability is a term that takes lots of forms, and this can include things like social isolation, bullying, and abuse. The reasons I wanted to research social vulnerability in WSS are very little is known about WSS psychologically or educationally, and most research is in genetic and medical aspects of WSS. Now, some of you may remember that in my last project, I started investigating these behavioural characteristics of WSS, and I did this by interviewing parents of children with WSS, and I found that parents often said their children are socially confident and will often approach and talk to anyone, even if they don't know them very well. So I later went on to research this a bit more in the literature, and I found that children with other genetic disorders, which are potentially similar to WSS, also show these very social behaviours. So for example, children with the disorder Wiedemann Syndrome, they show things like a lack of stranger awareness, and they sometimes aren't aware of social cues and often act socially inappropriately. So because of these similarities, I wanted to investigate social vulnerability further, especially as parents raised some concerns about these behaviours, particularly as their child gets older. So I aim to find out whether children with WSS are socially vulnerable in different ways to children with other conditions, and whether being socially confident is a key feature of sociability in WSS. So I created an online survey, and this survey asked parents some background questions and then touched on their child's social vulnerability. And I compared these responses to parents of autistic children and parents of children without a disability. I had 128 parents who took part in the study, so thank you so much. And children were ages 4 to 17, 38% of them were female and 62% of them were male. The questions were broadly split into 5 categories, or subscales as they're known in the literature, and these were emotional abuse, risk awareness, social protection, vulnerable appearance, and credulity. I found that children with WSS and also autistic children were rated significantly more socially vulnerable overall compared to children without a disability, and that's quite an unsurprising finding. And from this, we know that children with WSS are socially vulnerable compared to their peers who don't have a disability. I also found that children with WSS were rated higher on the vulnerable appearance subscale, and this subscale asked parents questions about how their child is perceived to others and whether others recognise that they have a disability, and also whether they are perceived as immature for their age. The other important finding was that children with WSS were rated as being less risk aware than autistic children and children without disabilities. And now this subscale asked about things like reading social cues, recognising dangerous situations, and telling parents if something questionable happens. So the important things that we need to take from these results are that children with WSS are socially vulnerable according to this questionnaire, and they are particularly vulnerable in areas related to risk awareness and how other people perceive them. So what do these results mean, and what can we take from them? Children with WSS often display a social profile of something known as hypersociability, and this means that they are highly social, as the name suggests, and that they also display social behaviours like talking to strangers, or approaching people that they don't know. This social profile of hypersociability is similar to the profiles that are seen in other genetic disorders like Williams syndrome. So for future research, it would be really useful to look at the similarities and differences in these profiles in a bit more depth, and to see whether there are already some pre-existing interventions that have helped others with a hypersocial profile, so other children with other disabilities, and whether these could be used for children with WSS. And this may help with some of the social differences that may be more challenging, like approaching strangers and not understanding dangerous situations. And as I've said, these findings are just the start of the research into social vulnerability in WSS, but what they do is they begin to give us an insight into the ways in which children with WSS are socially different from their peers. And now we know this, we're beginning to share these results with stakeholders, so including health and education practitioners and teachers and parents, like we're doing today at the WSS conference. We're very keen to raise awareness of these findings so that more people have an understanding of just some of the characteristics of WSS. I'd like to thank the WSS Psychology Lab for helping me with the project and for helping me create this talk. And I'd also like to thank you all for listening and for taking part in my survey. Thank you very much.